Welcome to the Health Matters Podcast. I'm your host, Kareem Amiri, and today I have Tyler Elliott, Group Medicare Consultant, to join me to talk about Medicare. With full retirement age for Social Security reaching 67 for those born in 1960 and after, a question that employers are increasingly getting is, hey, I'm now 65. What happens to Medicare? And Tyler's here to join me to discuss that question. And Tyler, I know you're a veteran of the podcast, and most people know you, but for those that don't, please reintroduce yourself and talk a little bit about what you do at Wellmark.
Awesome. Yeah, it's the third year, so I guess
Yes.
I'm reaching veteran status at this point.
Yes, you are.
But for those of you that haven't been able to tune in, I work on our Medicare business team, and really what we do is offer consultation to employers on Medicare solutions for those employees that they have that are approaching retirement age. Medicare is not the most fun topic in the world, but we hang our hat on and really find passion in helping people navigate through that maze that can be Medicare. So we're happy to be here.
Well, thank you for joining me again. And, I mentioned at the beginning, why this is top of mind for employees when they're reaching that age. But for employers, what are some of the most important things that they need to think about?
Yeah, we know that working beyond 65 is probably one of the more confusing points along that Medicare journey. We get a lot of questions on it. Things like navigating what plan would be primary if you have both employer coverage and a Medicare solution. Thinking through, is that plan that employee is on creditable?
So let me jump in really quick. Could you briefly explain what creditable coverage is?
Yeah, so creditable coverage, there's a whole actuarial value behind it, but the easiest way to understand it is the prescription drug coverage that you have through your employer is just as good, if not better, than what Medicare provides. And that threshold to meet creditable coverage will be raising for 2027. So that is one of those considerations to take into place. And then lastly, for people that do work beyond 65 and now they're 67, how do I enroll and when do I need to do what I need to do in order to avoid any sort of penalties that can come down the line?
Yeah, I'll echo what you said about the creditable coverage. I know for my team and the employers we work with, that is a question that as the fall months approach us, we'll get more and more during that time of year. So I know we'll talk about that a little bit more. And, you mentioned some of the things to think about from an employer perspective, but what should employers understand about Medicare, when those employees work past age 65?
Yeah, kind of back to that credibility conversation, I would say the baseline for an employer to be able to help those employees is knowing if that plan that they are on is considered creditable, and knowing that employees do have an option to work beyond 65 if they choose to and stay on that employer plan. They can delay going on to Medicare. The key is just making sure that plan is creditable. And from there, they can help them navigate, do I switch my employer plan to make it a creditable plan, or do I just go ahead and go on to a Medicare solution?
So you mentioned a little bit about employees delaying or enrolling into Medicare. What part of Medicare do they have to enroll in immediately, and what part do they have to enroll, or can they delay?
Yeah, so most people will sign up for their Part A under Medicare when they're first eligible. And just to kind of tee up those different parts, under Original Medicare, you have your Part A and you have your Part B. Your Part A is your hospital coverage, helps cover things, really anything inpatient.
Okay.
So skilled nursing would fall under that category. Medicare approved, home health care, and hospice care would also fall under that category. Then you have your Part B, which is your medical coverage. Think of anything outpatient when you're thinking of Part B. So doctor's
Office too,
visit,
yeah.
specialist,
Okay.
lab services. You have Part D as well, which is your prescription drug coverage. So in terms of what you would get enrolled into and when, if you're going to work beyond 65, you would typically enroll into Part A. And again, Part A is your hospital coverage, and it acts as backup coverage to your employer plan. So you have that added coverage there. If anything were to happen and something slipped through the cracks that wasn't covered by your employer plan and was covered under your Part A, that would cover that for you.
So I'm still working. I'm enrolled in Part A. It's secondary to my employer plan.
Correct. The other point to that is Part A is typically free. So if you have worked for 10 years or 40 quarters, you have premium-free Part A. So it makes sense to go ahead and get that part out of the way. You're not paying for it, and you have that backup coverage. Now, on the flip side of that, your Part B, which is your medical coverage, and your prescription drug coverage, Part D, you would go ahead and delay because there's usually premiums associated with that. And just like your Part A, your employer plan is going to pay first anyways. So it doesn't make a ton of sense to pay a premium on something that you might not even be using.
Right. And then we had mentioned creditable coverage. That's where the Part D plan comes into play. If it's not creditable, then the employee, or if the employer plan is not credible, then the employee needs to get that Part D plan.
Correct.
All right. Thank you. So one thing we haven't touched on quite yet is HSAs, health savings accounts. So with more and more people going on to qualified high deductible health plans, the question that comes up is, how does that impact my Part A?
It's a great question, and we'll go against what I just said. The normal person will do.
Okay.
The one exception to not taking your Part A when you're first eligible would be if you're someone that contributes to an HSA. So the rule is that you can't be on any part of Medicare and make contributions to your HSA. Now, a retiree can use their HSA funds to help pay for most Medicare premiums. So your Part B premium that you'll always have, any sort of premium for your Part D, any sort of additional coverage premium, and then also deductibles and copays.
So you said they could use their HSA to pay for those premiums.
Yes, you can't. The only thing is you can't continue to contribute to it.
Got it.
Yep. The other important factor to think about with an HSA, if you are someone that works beyond 65 and let's say now you're 67, is when you go to retire and you make your Medicare active, Medicare will actually make your effective date 6 months retroactive from the date that you signed up. They do that just to make sure there's no sort of gaps in coverage and you can avoid any sort of penalty that might come with that. But because they're making that coverage 6 months retroactive, you also want to make sure you stop your HSA contributions 6 months before you sign up for any part of Medicare.
Got it. So like you said, you could delay Part A, and if you're on an HSA, but you want to make sure you do it 6 months, and that 6 months before you turn 67.
Correct.
All right. So when you think about that, another question that employers might get or employees are thinking about is, okay, what are the cost differences between staying on my employer plan or moving to Medicare?
It's a really good question, one that comes up a lot, especially for those people that are working beyond 65. When you look at your employer plan, you're really looking at, what do you pay in terms of premium for that plan? What are the deductibles? And then what are the common co-pays or co-insurances that you might have on that plan? When you compare it to a Medicare solution, the primary thing, or really the first thing you want to do, is narrow in on what extra coverage option you're going to be going on to, because all of those will act a little bit differently in terms of how you pay for it. So that would be the first thing to do, is just narrow in on what plan you're going on to. Then you can accurately compare that employer plan cost versus that Medicare plan that you're looking at. Wellmark has a couple of free options that are easy to use for employers and employees. One would be our team, that Medicare business team, more than happy to help compare those costs. But we also have our Medicare telesales team here at Wellmark. They're an internal team. They actually sit right next to us in the office, and they can bring up that employer plan, if it's with Wellmark, of course, and then compare that to a Wellmark Medicare solution side by side to really help employees navigate what that cost differential might look like.
That's fantastic. Actually, I don't think I was aware of that they could call in and do that. Mm-hmm. We're nearing the end here, and really every situation for an employee and employer could be different. But when you think about those questions that an employer might have, especially the main question we've had today, who can they reach out to discuss that? And I think you talked about that a little bit, but might as well repeat it.
Yes, absolutely. So they can reach out to the Medicare business team, especially employers, if they have resources that they're needing, if they're wanting education for their employees or just have questions, or even if their employees have questions, they can reach out to us. And our email address is medicarebusinessteam@wellmark.com. And then if your employees have further questions or they're wanting to compare costs of plans, or if they're looking to get enrolled, they can reach out to our Medicare telesales team. And their phone number is 877-227-5161. And we say this every year, but we know that Medicare can be really overwhelming and confusing, especially to an employee that is getting to that point and trying to figure all of these things out. Employers shouldn't have to be the experts, and employees shouldn't have to navigate this alone. So that's really where our team comes in to help.
That's fantastic. Thank you for joining me to discuss this today. And, is there any last words you want to say? I mean, that was a great way to end it, but is there any other words of wisdom you might have for everybody?
Don't do it on your own. Yes. Reach out for help, whether it's an agent that somebody works with, or reach out to Wellmark, and we can give you the resources to help figure things out.
Thank you, Tyler. And to those of you listening, thank you again for joining us on the Health Matters podcast. If you liked what you heard today, please go out to YouTube and subscribe to the Wellmark channel, Health Matters, and you'll find us with plenty of topics out there. Thanks again, and have a great day.